and welcome to our Path to Empowerment Living with Multiple Myeloma program here at Patient Empowerment Network. I am the Myeloma Empowerment Lead here at Patient Empowerment Network. My name is Lisa, and I'm also a myeloma patient diagnosed back in April of 2018. I started having pretty significant pain in my hip about 1 or 2 years before I was diagnosed, had a spine x-ray, didn't show anything, and about 5 months later, went in for an MRI and was diagnosed with a large plasmacytoma that had eaten away at part of my spine. I have been fortunate enough to have care at MD Anderson. I was able to go down there both for my spine and for my cancer. I met with the radiation oncologist immediately upon going to MD Anderson, who had me go through 8 sessions of radiation. My treatment consisted of the radiation and then spine surgery to support my spine, because my spine was compromised and the tumor was close to my spinal cord. All of that was followed by, I met with a myeloma specialist, Dr. Karina Patel at MD Anderson, and she wrote my prescription and orders for chemo to be done back in my hometown of Boise, Idaho. So I came home for 6 months of chemo. I had it every week for 3 weeks on, 1 week off. And my chemo treatment consisted of KRD, which is carfilzomib, Revlimi and Dex, also known as Kyprolis, lenalidomide, and Dexamethasone. I did have that for 6 months on, like I said, 3 weeks on, 1 week off. Had a great response. My last treatment that I had, I followed that up by going to Seattle to have stem cells collected, and was also restaged. My cancer was restaged in Seattle, was MRD negative at 10 to the -5. And at that point, I opted to wait to have my stem cell transplant until first relapse. And since then, I've been on maintenance therapy for about 3.5 years. Revlimi, also called lenalidomide, was on it every day until about a year ago when I was given 1 week off after 3 weeks on. And for the past 10 weeks, I've been completely off of maintenance therapy due to side effects of getting progressively worse, including neuropathy and digestive side effects. So that is my history with myeloma. We are very fortunate today to have 2 other patient panelists, Jim and Sherry, who will introduce themselves. I'm going to back up for just a minute. People like to know the type of myeloma we have. I have kappa light chain only myeloma, which means I do not have an M spike. I'm followed with the free light assay that shows kappa light chains in my blood, and also a 24-hour urine that will show Benz-Jones proteins in the urine. So kappa light chain only, my cytogenetics. I feel like I have to share my zodiac sign too, but my cytogenetics are translocation 1114 and monosomer 13. So we'll move on to our patient panelists. Welcome them. Sherry, she is a support group leader for the International Myeloma Foundation here in the Treasure Valley in Boise, Idaho. So Sherry, if you could just introduce yourself, please, and explain your history with myeloma, the treatments you've had, current status, and type of myeloma, that would be great.
Hi, so I'm Sherry, and I was diagnosed in October 2011 with IgG kappa myeloma. We found my myeloma because through blood work to check, just kind of more of a routine check, it was discovered that I had kidney failure, and my kidneys were only functioning at 8%. Normally should be 100% or close to that. So 8% kidney function, didn't know why. It took a couple of weeks and a bone marrow biopsy to figure out that it was because of myeloma. So IgG kappa, but no cytogenetic markers, no high risk markers, just standard normal myeloma, but it did attack my kidneys versus my bones. Very minor small lesions that I had. Anyways, that was 2011 in October. Within a couple of weeks, I started dialysis and started my first treatment, which was in 2011. They weren't really doing doublets and triplets very much. So it was, well, a doublet if you want to consider Velcade, which is bortezomib plus dexamethasone. So I was on those 2. And I did 4 cycles from October to the end of December to get me ready and see if I had a good response for a stem cell transplant. I had a stem cell transplant in March of 2012. I got a very good partial response for my stem cell transplant. Still had a small M spike, but because of the dialysis and my kidney issues, I decided not to do maintenance therapy. Really the only, or the standard maintenance therapy was Revlimi. And I know Revlimi can be tough on your kidneys. So I decided, after researching it and talking with my doctor, not to do maintenance therapy. So I was off of therapy for 2 years, but my numbers had started to increase. So in April of 2014, when faced with having to go back on something, I asked my doctor if I could do Velcade again, because I'd only done it for 4 cycles, really only about 2 months worth. And he looked into it and said, yeah, so that's what I did for 6 years. Velcade as therapy, maintenance therapy, if you want to call it that. But I did it solid 3 weeks on, 1 week off for 6 years. When that started to quit working, and I started looking at changing treatment again, I changed to Darzalex Fast Pro, Revlimi this time at a low dose, and Dexamethasone. And it has been 2 years since I started that treatment. I am now on monthly Darzalex, and I stopped the Revlimi in February because, again, of lower blood counts, and it can be tough on your body. So I stopped the Dexamethasone as well. So I'm only on Darzalex once a month, and it seems to be holding. It did finally put me into a 0 M spike, complete remission, which I really hadn't been in 10 years. So that's a good thing. And I'm still holding my own with that right now. So kind of that's my story. Oh, and I was able to get off of dialysis. I was only on dialysis for 2 years, and my kidneys recovered just barely enough to stop dialysis. And they have slowly improved over the 10 years or over the 8 years. And my kidney function is generally around 25% right now. So that's where I'm at.
Thank you. Well,
Yeah.
Thanks, Sherry. And Jim, if you would please introduce yourself and give a little bit about your history and the treatment that you've had.
Sure.
Yeah, thank you.
I am James Bond, and I'm the real James Bond. I'm not the movie actor. And my beautiful caregiving wife, Kathleen, if she were here with me, you'd believe that I am the real James Bond. But I was diagnosed in 1992, so that was 30 years ago. And I was at stage 3 with capital light chain, like you, Lisa. And I've had some treatments during those 30 years, and I can recap those for you. It's pretty easy. The first 10 years, I had 3 transplants. There were no current day modern drugs for myeloma available. And I was one of the pioneers in the clinical trial that got Velcade approved. In fact, it saved my life when I was told to go to a hospice. Instead, we were lucky enough to get in that trial, and that was up in Boston, away from our home. And I hit a home run, got saved, and Velcade got approved. And I've really not been in danger with myeloma since then, although I have been in a total of 6 clinical trials, and including Revlimi that you've been on, Lisa, and helped that one get approved. But ever since Velcade, my myeloma has not been life-threatening. Another highlight of the treatments that you asked me to tell is that I did get treatment-related leukemia, and they're not positive why. But one of my transplants, I had to have full-body radiation as part of the protocol, and I took some other drugs like melphalan that we all have to take for transplants, but those are the leading suspects for what may have caused the treatment-related leukemia. But I was very, very fortunate, and they were able to find an unrelated donor, and that matched my stem cells, and I had a 4th stem cell transplant over a decade ago. and that put the leukemia in remission. And where I remain today on both cancers. And a side note to the last allo transplant, my 4 transplants break down 2 autos and 2 allos. But my last allo was from a woman living in Germany. And it kind of explained to me why ever since that transplant, I've had this urge to go to Oktoberfest. But more seriously, I've had some serious side effects, the most prominent of which is graft versus host disease from the other person's cells, which affects my skin, my gut, and surprisingly, the surface of my eyes. I had to get special contact lenses that I have to delicately put in, take out every day to return my sight to normal. But it's worked out really well.
Thank you, Jim. And I'll just provide a quick reminder that this program is based solely off of our patient experiences and should not be substituted for medical advice. So please see your physician or any qualified healthcare provider if you have any questions about your medical conditions, including myeloma. You do have an opportunity to ask questions of the patient panelists at the end of this program. If you use on your Zoom, there should be 2 little buttons, one a Q&A function and one a chat box. Submit your questions there, and our behind the scenes producer will be watching for those questions, and our patient panelists are available to answer those questions at the end of our program. Just that reminder about with our medical disclaimer. So we're going to jump right into our questions that we have now for the patient panelists. And Jim, I think I'll start with you. You already established some of the treatments that you had, but sometimes when I go to our support group meetings, for which Sherry leads this group here locally, people will say things like, I really wish I had known this about treatments. Is there any 1 or 2 things that you wish you had known, looking back now, that you wish you had known going into any particular treatment that you do know now?
Yes, there are a couple that stand out, and they're the subject not only of my book and our talks, but I started doing episodes, 4-minute episodes on YouTube. And one of those episodes is on my experience with using steroids, which one or both of you mentioned. Dex is one of the components of one of your treatments. So dexamethasone is the most powerful steroid that I use, and it was required with getting me ready for my first, second, third, and fourth transplants. And it was also a steroid that was used for a while. I did do maintenance before I got leukemia. And the thing I wish I'd known about steroids from the beginning is after I had one of my 2 hips replaced, the hip surgeon told me, Jim, you know, you cancer patients are at higher risk for needing to get a hip replaced, something called avascular necrosis, because of the long-term use of steroids that you're required to do. Well, when I found that out, it's been 15 years ago, I started challenging my doctor. I said, look, can we try that maintenance that you got me doing, but do it without the prednisone steroid? And he balked at that because that wasn't the way they were doing it. But I said, how can we work it out? Because I'd really rather not get the other hip replaced, lower my risk. And we agreed to something in between. He said, if you're willing to come in here every 6 weeks and monitor your blood, then I'd be happy with you staying on no maintenance. So that's really what I've been doing. And had I known that earlier on, I probably would have stopped the prednisone earlier on. There's nothing I can do about the Dex required for getting me ready for the transplants that are part of my story. But that would have been helpful to know.
So one of the questions too that somebody asked me a while back, had been diagnosed for a few years, gone through induction stem cell transplant, lived in the Boise area, had never seen a specialist. Can a person, if they haven't seen a specialist from diagnosis on, can they seek the advice of a specialist anywhere during their myeloma journey?
Yeah, I think so for sure. I mean, for the first probably 2.5 years, maybe, I didn't consider seeing a specialist because what I was doing was pretty straightforward. I had standard risk myeloma, and I was a newbie. I was a rookie, and I just kind of went along with what my doctor said to do. And I don't think I did anything wrong. I don't think I made a wrong turn. I should have done something different. But the more I started reading and researching, the more I realized that being with someone who deals with just myeloma and a large number of myeloma patients, because like Jim said, everybody's myeloma is different. So when you see someone who's dealt with a variety of myeloma cases and can see the differences, it's helpful. So that's when so it was probably closer to 3 years in my journey before I saw a specialist. And then I saw that specialist, I saw her for a couple of years, once a year kind of a thing. And my myeloma was stable. Once my myeloma changed and I wanted to see somebody closer to home, relatively speaking, I changed specialist because it was easier to see and travel to. And again, I knew my myeloma was on the rise again, and I wanted to get a specialist opinion because there were so many choices of treatment. And this was just 2 years ago. And the landscape of myeloma had changed drastically. So I really wanted to see a specialist and find out, now what do I do now that I'm making a change? And so I think anywhere in your journey, if you've never seen a specialist, you can certainly see one. And I know as a support group leader, I'm very happy that I have convinced some members of my support group to see a specialist because their myeloma is getting tricky to handle, and they need someone who has seen more cases and has a better idea of what they should do at that point.
How did you choose your myeloma specialist?
It was funny. My husband said, if we're going to go see a specialist, we're going to see one of the best. So we kind of, looked at the top 10 list. We went off of a website that had done a lot of research and ranked and listed specialists. And this specialist at Duke, my son was living in North Carolina, and we thought, well, she's one of the best. We can visit him and we can go to the specialist. So that's why we chose to go all the way across country and see a specialist. When I changed specialist, one of the reasons was my son had moved back to Idaho, didn't need to go to North Carolina anymore. And I had met this specialist in person, really liked him, had a good rapport. My husband met him at a patient conference and really liked him as well. And he said, we should see if we can switch and see him now because it's closer and I just really like him. So that's how I made my decision there.
One of the questions on the homework was, what about access to treatments? And I'd like to say something about that. We had to pull up stakes at a drop of a hat and relocate from 600 miles from Cleveland, Ohio to Boston, Mass for this all-important what turned out to be a Velcade trial. And we were able to do that financially. I had a great job. I was still working, great insurance. And my wife and I looked at each other and thought, what about people who don't have the resources to do this? And my wife is a 40-year volunteer for the American Cancer Society. And she's become a real leader with them, including their national board of directors. Well, she pointed out that that's why the American Cancer Society has over 30 Hope Lodges around the country where cancer patients and a caregiver stay for free while they're being treated, typically for out-of-town treatment they can't get at home. And that's really good information for people to know, because even though there's only 30, there are a lot of cities and states in our country, the American Cancer Society has a relationship with at least one hotel chain where they can help with very inexpensive accommodations while you're out of town for cancer. So the American Cancer Society, 24 hours, 7 days a week support line. It's really someplace to look if you're having trouble with finances on getting out of town.
Thanks, Jim. And you mentioned something too. I think we're all on board with our feelings that seeing a specialist is critical on your myeloma journey at some point. However, that requires the financial means to be able to do that, to be able to travel, to pay any co-pays or out-of-pocket expenses that you might accumulate from that. Or even when we went down to MD Anderson, I was scheduled to go to appointments for 5 days. We stayed down there for a month because I had to have emergency spine surgery. All of those are unexpected expenses. So I just want to say, if anyone has questions as they're watching this, feel free to contact me. I have an email, cure4mm@gmail.com. It's the number 4, cure4mm. I won't know all the answers. I have a lot of great resources, including Sherry, who leads our support group, to help try to find resources for people who are seeking a second opinion or a myeloma specialist. Even if it's just once during your myeloma journey, please reach out, because there are resources out there, whether it's through the IMF or the LLS, the Leukemia and Lymphoma Society. There are resources. It's critical to seek out the advice of a specialist at least once during your myeloma journey. So just wanted to put that out there. And Jim, I do have another question for you. I did read your book. I have it right here. Thank you for doing that. It's a very easy to read book, and it provided a great perspective on, because myeloma is incurable, how can we live with this for 30 years and still live our lives while going through treatment after treatment? And you had great insight and inspiration in your book about that. So thank you for putting that out there. But it brings up a big question that I had, and I still have. You had talked about the plasmacytoma that had developed on your head and had radiation. And I think it was that point, I have it earmarked in the book. One of my big, I'm terrified when I ask a question of a doctor, because I'm afraid it's going to appear that I'm questioning their expertise. If I disagree with a treatment or if I'm uneasy with the treatment, I have a hard time saying, hey, I think that this might be a better option for me. Well, in your story, you had, during this time of this plasmacytoma, you mentioned that you were on a maintenance drug. Your doctor, one of your doctors wanted to add a second drug, I believe, to your maintenance regimen, just to make sure that everything was knocked down as much as it could be. Your abnormal proteins were increasing. You felt you just wanted to increase the dose of the one drug you were on rather than adding another drug.
Yes.
So my question for you is, you did approach your physician. You had a method of doing that. How did you do that?
Yes, that was the most contentious I've ever been with my myeloma expert, Paul Richardson. He and I and my wife are really good friends. I mean that. I mean, we're talking close friends. So I was at that point where I was on a little bit of a maintenance drug. I think it was Revlimi, and my protein started to go up. And Paul wanted me to add Velcade to it. Well, my strategy is I wanted to hold on to Velcade in case my life was ever in danger, because it was one that really saved me when it was. And so I resisted, and I said, Paul, let's just try increasing the dose. And he resisted. And it was a little contentious over the telephone. And finally, and here's the key. We had a really good relationship with Paul's oncology nurse, Debbie Doss, who's now retired, up at Dana. And Debbie said, Jim, let me talk to you privately. And she and I got on the phone privately without Paul. And she said, Jim, here's the thing. You're not going to convince Paul based on the myeloma knowledge. He wins that argument every time because he knows it. He said, what you can make progress on is what you're comfortable with. And if you come at it from a standpoint of, Paul, I'd be more comfortable trying to increase my dose and give it a month and see how that goes. That worked like a charm. And so it was the study nurse who got involved, saw that she had two people who were kind of dug in, and I listened to her closely, and that really mitigated what could have been a difficult situation. Now, here's the really surprising thing and great thing is then after I upped the dose, And he was hesitant. He had me do another this, another that to make sure there was no other problems in my body. And when the protein then went down at the higher dose, I thought he might be a little bit miffed that whether it was dumb luck or what, my call worked out. First thing out of his mouth on the phone was, "Jim, good call, good for you." So, I mean, that's the kind of guy he is. He puts ego aside and he just wants to do the right thing for his patients. And same doctor called me at 8 o'clock at night when I was having real difficulty with that fourth transplant, the one for leukemia. And I was there for 75 straight days. And he called me one Sunday night and assured me I'd make it through. And that meant a lot to me at the time, and it still does. And that did help me get through the thing. So a relationship with doctors is really important. And you're right, not to want to rile your relationship with your doctor, but the words I'm more comfortable with go a long way with me and my doctor.
That's a great piece of advice going in, especially for those of us who don't want to question the medical expertise, to say something just like that. I'm more comfortable with this, and then they can consider it. And I think it's a team effort. It's a collaboration. When you're dealing with a lifelong disease like myeloma, it has to be a collaborative effort for the best outcomes. So
that's exactly. We look at it. Look, you know the science and the biology, and that's great. But we know 30 years of history, and we know our own risk tolerance. And by putting those two together and collaborating, like you said, Lisa, I think we get the best answer.
Mm-hmm. Yeah, great. Thank you. So Sherry, I know that you have gone through, well, you had dialysis. There are all kinds of treatments that are involved with myeloma. We have radiation, we have surgery, we have chemo. Some people have dialysis. Stem cell transplant. So focusing on the chemo aspect, because I believe every myeloma patient will have chemo at some point. Some of the questions that come up with that are, what is that like when you go? And when you were first diagnosed, were you able to do some of your own prepping to develop questions? And did somebody prep you? Did they provide an education? What did it even look like when you went into the chemo? So what did it feel like when you walked in there? I just figured when I went in, it would be people laying in beds getting sick. They were all going through chemo and nobody would have any hair. 80% of the people had hair still. So what was it like for you when you first started chemo? What kind of education did you get? And what did it feel like just walking into that chemo suite the first time?
Well, it's funny because it was almost 11 years ago and it's very different than it is now. There was kind of no real walking you around the chemo suite and whatnot. In my case, I think it's because I saw my doctor downtown in Boise, but because I live in Meridian, just outside of Boise, I went to the facility that was there because it's a little closer to home for most of my treatments. But I liked my doctor who was downtown, so I wanted to go there. So anyways, I think because I was back and forth between the two, maybe. But now I know that they have a program with new patients where they walk them around, they show them the chemo suite, they show where you're going to get your treatments. And so it's very different from when I first went in 11 years ago. In fact, when I went in, I really didn't know I knew what the name of the treatment was, but I did not know anything else. I didn't know how it would be administered, nothing. And they had just started in our hospital here locally, they had just, and I think, most of the country had just started switching over from Velcade, which was given in the IV form in the beginning for years, to the sub-Q injection. So when I sat down to get my first chemo, because I didn't know any better, the nurse started an IV in my hand. But then somewhere along the lines in my head, I was like, I thought this was going to be a shot, but I just didn't know what they were doing. And so I asked her, I said, aren't I supposed to get this as a shot in my arm at the time, I thought? And she's like, oh my gosh, I am so sorry. And, ended up taking the IV out. And, to this day, I still tease her about that. But Yeah, so I feel like I was a little unprepared. I don't think the hospital necessarily did a good job of preparing in the beginning. I think they have gotten much better about that, but I do always try to help the hospital from a patient perspective of, you really need to do this. When I was a brand new patient, this is what I would like to have had. I would like someone to have told me about a support group. I would like them to have told me what my treatment was actually going to be like on that first day. And I think they're getting better about that. But a lot of that is on us as being our own best advocate. You know, like Jim said, you know, they know the myeloma stuff, but you know your body, you know yourself, you know what you're comfortable with. So you have to ask. At some point in my 6 years of getting Velcade after I relapsed, the first probably 2 years, I got the shot in the back of my arm because that's what everybody did. But then I read about it online, and yeah, you can't trust everything you read online. You have to be careful. But I read that it was, a lot of people were getting it in their belly, that it was originally intended to go in your belly. And I asked about it, and they're like, well, yeah, we can do that. And now most people I know at the clinic do get it in their belly. And so it's just a matter of educating yourself and asking questions, and don't hesitate to ask a question. That's the only way that you will get answers. It's the only way you will learn. And sometimes it helps educate the doctors and nurses around you as well.
Thanks. So do you think if a new patient is going into chemo, it's really uncomfortable, do you think they would be able to ask, hey, can I have a tour of the chemo suite the week before or a day before my treatment begins? Do you think that would be a reasonable question?
I think it's definitely a reasonable question. And obviously, you know, cancer centers across the country, I have no idea how they do it, but I know ours here locally is getting better about doing that. It's a process now. Before your first treatment, they'll walk you around and show you everything. So you have an idea of what to expect, and you're comfortable, more as comfortable as you can be on your first treatment day.
I have one more or two more questions I'm going to have. I wanted to ask really quickly, both of you can respond to this. Jim, we'll start with you. During all of your treatments, have you had any unusual side effects that nobody was able to explain or that you hadn't heard of prior to starting that treatment?
Yeah, probably. The emotions got away from me at one point, and I lost my temper when I shouldn't have. And I attribute that to everything about I don't know if it was just steroids or just the treatments or what, but I like to ask questions. I'm not afraid to ask questions. So, you know, and I read the signals from my family that I needed to do something differently. And I asked my oncologist, who I'd become really good friends with here in Cleveland, and he recommended a professional, and I sought his help. And he sat me down, and he gave me some really good advice that I still live by. So, you know, that's something I didn't expect, and I don't know if I could have prepared for it, but just being flexible and letting your ego leave it at the doorstep and just realize, hey, you need these people's help to get yourself going, and just accept, in my case, accept that, you know, I'm not as young as I used to be. For one, you know, 73 is not 43, and there's certain things I just can't do anymore. So just gotta roll with that. So I hope that's of some value.
So Sherry, I know you had an unusual side effect because we talked about it. It was to Revlimi. And I remember getting the same side effect early on in my treatment. It was a really, really itchy scalp in the middle of the night, scratching. And the pharmacist actually I talked to didn't even know about it. So you and I talked about that. That was one of my unusual side effects that a lot of people didn't know about. Have you had any other unusual side effects that even your providers were a little bit curious why that was going on, and you think it was from the treatment?
When I was on Velcade, I kept getting styes on my eye, like right at my eyelash line, upper or lower. And we think that now that I've seen a lot of other people comment on Velcade that they have that as well. But at the time, doctors didn't really seem to know that was a side effect of the Velcade. I think that's why it's so important when you have I shouldn't say little, any kind of side effect or something that you have, you should ask, and you need to report it to your doctor and kind of report it to the pharmaceutical company. Because if these things are happening with other patients, but nobody tells the pharmaceutical company, then they don't know that's a side effect of that particular drug. So that's probably one of the ones that that we weren't sure. That and a lot of cramping, hands, feet, my face. That's what led me to get blood work in the very beginning when I first got diagnosed, was an excessive amount of cramping in my legs and feet. But after I started Revlimi, I had a lot of cramping. I mean, cramping, like my face would cramp, cramping in my hands. And we lowered my dosage of Revlimi, and that did help. But I don't know how many people get that to the point where I couldn't even drive the car. My hands cramped up so bad that I had to pull over until the cramping stopped, because both hands were cramping. So those are probably the more, I don't know if they're unusual. I think a lot of people may get them, but not an easy thing to solve. An itchy scalp. Yeah, that is crazy. That is crazy. I just saw someone who just quit Revlimi and then got the itchy scalp. And she asked, has anybody gotten that when they quit their Revlimi? Because she goes, now that I've been off of it, I have a really itchy scalp. So, you know, it's like you say, the cancer itself is different in everybody, and then everybody's side effects are just slightly different. So
I think you're right. That's why I like talking to other patients, because these unusual things, the doctor may not know what it is, but you talk to somebody else like, I had that same exact thing happen. You're right. I reiterate what you say. Let your provider know when you have side effects, and maybe even let the pharmacy or pharmacist at the cancer center know, so they can report that accordingly. So that's my last question is one takeaway that both of you have, whether it has to do with the emotional or mental health challenges of having myeloma, or just dealing with even more acute things like, oh my gosh, I've got a new treatment, how to deal with that emotionally. One takeaway that each of you has to help myeloma patients as they go through their treatments with myeloma. Sherry, do you have one thing that you can leave everyone with, or talk about the emotional challenges that you've had, how you've dealt with them?
You know, I think that I am different than most people. You know, in the beginning, it was a devastating diagnosis. When they tell you 3 to 5 years, that's devastating, because then you start, and I was only 49, so you start thinking about all the things that you thought you were going to have in your life, watching your kids get married, having grandchildren, retiring together, living out, you're traveling, doing all these things that you think you're going to do. And when you get that first diagnosis, it just throws everything in the trash can. And so the first 6 months to a year, probably, I focused a lot on that. But then you start to adapt, and you're living with it, and it's not as bad as what you thought it was going to be in the beginning. And it's a cancer that we will live with the rest of our lives, most likely, hopefully 30 years like Jim. You know, I've made it almost 11 years, which didn't think would happen in the beginning. So now it's just part of my life. It's like, I hate the term that it's a chronic illness. I don't like that. It is still cancer. You know, it is not just a chronic illness, but yet that is how we live with it every day. Like if you had diabetes, you get up and you take your insulin or whatever you take every day for diabetes, same thing. I get up every day, take a whole host of pills, go once a month for a treatment that keeps me going. It's just a part of my life now. But being a patient advocate has made it a little different, where it is always in the forefront of my mind. Everywhere I go, everything I do, I think about it from the support group standpoint, or for me as a patient standpoint, or whatever. But I think I like Jim's idea that maybe at 8 o'clock I need to not think about it so that I don't get burned out. but I'm one of those people that has always had a positive attitude about it. And I feel like for me, it's been easier to deal with than what a lot of other people go through, which is one of the reasons that I'm glad I started the support group, to hopefully help people deal with it a little bit better. But yeah, it definitely changes what you thought. And Jim was young when he was diagnosed. It changes what you think your life, the rest of your life is going to be like. You know, or at least that little map you had in your head of how things would go. But I am just, I don't know, I just deal with it, I think, easier than a lot of other people. It's never been out of my head to say, to have a positive attitude. And I know people get sick of that. You gotta have it, it's all about the attitude. But that's just been easy for me. And that's how I've always been my whole life, has been on the upbeat side. So, you know, it's been lucky for me.
Well, thank you for being a support group leader. You helped many of us. The closing thought I'll leave you with is, when we have this incurable, deadly disease, keep making your long-term plans. Don't let cancer get in your way. You have to change a plan, so be it. Keep making your plans, live your life, and you can do it. Hang in there.
Thank you so much to both of you for those positive words of wisdom. Keep making your plans. The first thing I did when I found out was telling my husband we have to update our will. So moving forward with our plans for travel and that type of thing, great advice. And I really appreciate that. So thank you to both of you so much for your information and for sharing your experience. We're going to move on now to the Q&A section. So I'll remind everybody who is watching this to use the little buttons at the bottom of your screen, the Q&A function, the chat button, and our producer will be forwarding those off to our patient panelists. Thank you.
Well, welcome everybody to our live Q&A session. As you can see, it's a different day. That was a pre-recorded session. So I'm going to welcome back Jim and Sherry, and they will be on to answer questions. We have a number of questions on the Q&A. We have a number of questions that were submitted via email and during registration. We'll get through as many of those as we can. I just want to send a reminder to everybody that we are not your healthcare providers. We're just strictly speaking from our own experience as patients. We encourage you to talk to your healthcare team. And even if you get one little piece of information from this program and you'd like to take that back to your doctor, I'm sure they would be willing to talk with you about that. So please remember that as you're asking questions, to keep questions a little bit more general, and to understand that we can't answer medical questions directly, but we will speak with our own experiences to your questions. I'm going to jump right in, and one of the questions that was submitted during registration, we'll start with that. This one will be for Sherry, and again, she can't necessarily speak to the efficacy of treatments, but she can speak to her own experience. Sherry, the question is, what other effective treatments are there for those in multiple myeloma remission besides Revlimid? If you could just review again, you were on Revlimid for maintenance therapy. I assume this person is referring to maintenance therapy. What other medications have you been on? And again, she's not endorsing these. She's just strictly maybe giving you some ideas to talk to your doctor about. So Sherry?
Yeah, in the beginning, when I decided to start treatment again, because I didn't do maintenance right after my stem cell transplant, but when I decided to start treatment, or needed to start treatment again, I was on Velcade. My husband always called it being on treatment, not maintenance, because it was 3 weeks on, 1 week off, and I did that for 6 years. So that, along with dexamethasone for probably 2 of those 6 years, that is a treatment option. And it's typically an upfront treatment option for people. And it can be, I know quite a lot of people who are on Velcade as a maintenance program. There's obviously the Revlimid. And I'm on Darzalex now, which again was given when my cancer markers and numbers, my M spike was increasing and I needed to change treatment. So I was given Darzalex, Revlimid, and Dex, and I'm still on Darzalex now as by itself. If the Revlimid had not lowered my blood counts so drastically and they weren't bouncing back on my weeks off, I would have still been on Darzalex and Revlimid as maintenance, but now I'm just on Darzalex maintenance. So that is those are some options that I've had experience with.
And that's great to hear, because I know that kind of the go-to for maintenance is Revlimi. That's what I've been on. So I don't have experience with anything else. And as long as you were talking, Sherry, there was a question that you were going to answer live about what you would do differently if you were diagnosed today. Could you answer that question for the audience, please?
Yeah, years ago, before I was on Revlimid, in my head, I said, if I had it to do differently again, I do two things. One, I would have consulted with a specialist right from the very beginning. And through that, I probably would have gone ahead and gone on Revlimid maintenance after my stem cell transplant, even though I was on dialysis, because a couple of years later, speaking to a specialist, she said Revlimid can be dosed accurately to not totally affect your kidneys. So looking back, I would have seen a specialist, and I probably would have done some sort of maintenance therapy right after to give me a longer time before changing treatments. But now that I've had 18 months of experience with Revlimid and the way it was for me by lowering my blood count so badly, I think now that I'm okay that I didn't do any maintenance for 2 years. So that's kind of a tough choice, but I would definitely have seen a specialist right from the get-go.
Okay, that's good advice. And Jim, how about you? Is there any piece of advice of something you might do differently if you were diagnosed today?
Very little. We try not to look back. We try to stay in the moment as best we can. I think all cancer patients, including me, went into it with the idea that the doctor and nurses, they really have all the answers. We really should follow everything they say. But as I got more and more experience, along with my wife, I guess looking back, maybe I could have spoken up earlier. For example, I haven't done maintenance in 10 years, and that's not the preference of my doctors. That's my preference. And I'm willing to go in and get my blood checked every 6 weeks as something as kind of reconcile the two views. But they're just human beings like the rest of us. And I just think just opening up and developing a good relationship early is really helpful. And it worked out, but maybe focusing on that more at the front would have helped.
Okay, well, thank you for that. So we do have a lot of questions about side effects and how to deal with those. I want to make a comment. We did have a question that came in via email. Are red blotches on arms and legs and a chronic cough side effects of Revlimid 5 milligrams taken while in remission? And just to answer this a little more generally, I think that your doctor may tell you, mine told me, that any medication can cause almost any effect and it's hard to know, which effects come with which medication. From my own experience, I did develop red blotches on my arms and on my hands, and they actually got swollen. So I did look at their website. It's Bristol Myers Squibb, now formerly Celgene, that manufactures Revlimid. That is a common side effect, both the rash and also the chronic cough. Something you should definitely talk to your doctor about, though. And it's always nice to kind of see those images. I actually was going to print a picture of what the rash looked like on my back. I also got it on my back, but I wasn't sure my producer, who's also my boss, would be super thrilled with me putting that on a live program. I know from my experience, my doctors did say that rash on my arms and on my back, on my torso, was caused by Revlimid. And when it comes to side effects, another comment I was going to make about clinical trials is that when clinical trials are done, they're looking at the maximum tolerable dose of a medication, not at the minimum effective dose. So for anybody who's experiencing side effects, it might be helpful to ask your doctor if there is a lower dose that you can take of that medication and see how it goes. Then we're not saying if that's the best idea for you, but working as a team with your doctor, he or she may have an idea of how to reduce that dose to see if the side effects can also be reduced with that. So I'm going to move on to another question about, have either of you had different experiences with foods or supplements? I see that Sherry said that she does use, I don't know how you say it, curcumin. Don't know if it helps. Don't know if there's any, there's a study being done on that right now at clinicaltrials.gov. If you look it up, and you can just do a search for that. Jim or Sherry, have you have you used any foods or heard from your providers that certain foods may help with not only the cancer, but also with side effects? Jim, do you want to start with that one?
Sure. At one point during one of the drugs I was taking, I also developed cramps. My cramps would be at night in my legs when I was trying to sleep. And when I brought that up to my nurse and doctor, my nurse said, Jim, this doesn't work for everybody. It might not work for you, but if you try just having a little bottle of tonic water next to your bed, the quinine that's in tonic water, if it's okay with your system, that may help. And it really did help. And so for a long time, while I was taking whatever drug it was, I'd take a few sips of the tonic water, and it made the cramps go away. So that was one. I'm not sure I could think of another one. Why don't you go ahead, Sherry?
Yeah, well, I mean, pickle juice is another thing. Talking about foods or things that may help with the cramping. But I know that there are certain drugs when you're on them, certain treatments when you're on them that you maybe should avoid. I think Velcade is one. You shouldn't be drinking green tea or grapefruit. It supposedly lessens the efficacy of the drug. Asparagus is another one, but those are all things that I would just maybe eat in moderation. Having kidney issues, I've always had to watch what I eat in relation to dairy products and anything that has phosphorus in it. Nuts are high in phosphorus. And most dairy is high in phosphorus. So my kidneys don't process it well because of the reduced function. But as far as the actual myeloma, any foods, I mean, obviously a Mediterranean diet, whole foods, anything like that's better for any of us, cancer or not. But in particular with the myeloma, no, I don't know of anything that's said, eat this and you're going to do better, or don't eat this because it will make your cancer worse.
And one thing I would comment on too is if your cancer center has an integrative medicine department, that might be a great place to go visit to ask them that question too. And I know they have the other therapies like massage and acupuncture. We had a nutritionist or dietitian for a while. I'm not sure if she is still there. I know they have one in the cancer center itself. So that might be a place to go to look into that too. Moving on to another question that's a little bit different is there's somebody who's asking online about wanting to know what a couple of people have asked about cure, if there's an algorithm for a cure. And I probably will ask Sherry that question in a moment because I'm not certain yet. I've heard some things from different webinars, but there was another question on that same one that is it possible to have bone marrow transplant or CAR T? I'm kind of skimming along here with stored for stored stem cells over 2 years or 5 years or 10 years longer. I think what that person is asking is, can those stem cells be used? I'm guessing that. I do know from my specialist, she said that she has used stored stem cells 13 years after they were collected, and they were found to be viable, and it was a successful stem cell transplant. So that would be something else to ask your doctor, is if you have had those stem cells collected and stored, how long are they viable for, and are they useful if you need them? And if the time comes you need them, they can test those for viability.
I don't think they can be used for CAR T though, because those are,
yes, that's
right, because those are different cells. They're harvesting T cells versus
stem cells.
Yes. So
yes, you're right. So thanks for that clarification, Sherry. Yes, they may be used for stem cell therapy, or even for, I think there's something called stem cell boosting if somebody needs to have their stem cells boosted, not for transplant. Again, something to talk to your doctor about, which would be great. This is a really quick question. I think it's valid, and I don't know the answer to it. I don't know if either of you do, but can a myeloma patient be an organ donor? Do you know that, either one of you?
I don't think so, especially because, you know, myeloma being a blood cancer and it's systemic running through our body. I think even if you were at MRD negative, I would not think And I don't know 100%, but I would think you're not eligible.
I don't even like the mosquitoes to bite me.
Jim, when I was on Revlimid, I had 3 years, no mosquito bites. I think they knew not to bite me.
Yeah.
So I've been off of it now for a couple of months, and I have gotten eaten alive by mosquitoes. Just saying, maybe they know something too.
Maybe they do.
Yeah. So, gosh, we have so many. Oh, go ahead, Jim.
Well, in terms of supplements, checking with your medical team is vital, no matter what it is. Whatever I mentioned about tonic water, check with your doctor first, because I was amazed when I had a cold years ago, and I proudly reported to my doctor this new cold medication I was taking, and he said, "Jim, don't do that without asking me. That contains zinc, and zinc is bad for your kidneys. And my kidneys are okay, but they're not great." And so that was a good lesson in things, even if it sounds like it could not be hurtful. It's wise for us blood cancer patients to check with our medical team first.
Sure. Yeah. Good idea, Jim. Thanks for that. Sherry, there are a couple of questions now to come in via email and the registration. And now I see one that's on the chat. If people don't have a local support group or group to go to, what are some options for them to find a virtual group or to find a group to attend?
Yeah, so I'm involved with the International Myeloma Foundation and our support group, who prior to COVID was meeting in person, but we're now meeting virtually, sometimes maybe a hybrid where some of us are in person and some are virtual. So if you go to myeloma.org, you can look up support groups and you can find support groups that are meeting virtually. I mean, it'll take you to their different websites, which will tell you whether they're meeting virtually or in person still. And so you can join those from anywhere. You just send an email to that support group leader and tell them you'd like to join their next meeting, and they can send you the link. Also, Health Tree Foundation has all virtual support groups, and they are done geographically. They're also done whether you're smoldering myeloma or MGUS, different people who are on different types of treatments. So they have virtual support groups based on like the Mountain West, Southern California, several in Florida, people who have patients with young children. They both, International Myeloma Foundation and Health Tree, have Spanish-speaking support groups. So there's a lot of options out there for virtual support groups, and you can join from anywhere in the country.
Thank you. Okay, that's great advice on that. Trying to skim through some of these questions also. So there were a couple of questions also that came up regarding using novel therapies and not going down the stem cell transplant. So autologous stem cell transplant. Jim has had an allogeneic transplant, which is not very common anymore. The stem cell transplants have been the standard of care. I also opted to delay mine. There was just, at the most recent ASCO, Dr. Paula Richardson, who Jim knows from Dana-Farber, completed the determination trial, which had 2 arms to it. And I'll just go briefly through this because we've had several questions. The 2 arms, one was VRD plus stem cell transplant plus Revlimid maintenance until progression. The other arm was VRD. I can't remember now if there was consolidation therapy. I don't know if you know that, Sherry, but no stem cell transplant, Revlimid maintenance until progression. Basically, the findings on that were really interesting. They found that progression-free survival increased for those patients, was greater for those patients who did have the stem cell transplant. However, that did not translate to overall survival benefits. The one caveat to that was for patients who reached MRD negativity after induction, they saw the same progression-free survival. It was similar for both the transplant and the non-transplant arm. It's a really interesting study. Dr. Richardson explains it really well. I just listened to, Sherry had mentioned the Health Tree. So if you go on Health Tree's website and look up, I think it's called Myeloma Radio or something, Jenny Ahlstrom from HealthTree did an interview with Dr. Richardson about this determination trial. Really interesting for those of you interested in hearing more about stem cell transplant versus no stem cell transplant. That would be something I would recommend. We've had several questions about that. So, okay. So we've got just a few more minutes left. We're going to save these questions and we can reach out to you via email if you provide an email address. I do want to look up the organ donor question and might try to post that somewhere because I'm curious about that myself. We've got a few too many questions to answer.
Lisa, could I
yes,
say
go
something
ahead.
real fast? There was at least one question about African Americans, and
Yes.
I would like to say that both International Myeloma Foundation, which is at myeloma.org, they have a program called Empower. They've done presentations. You can find those on myeloma.org about myeloma related to the African American community. And also HealthTree has another, they also have an initiative, again, specifically for Black Americans, well, just African Americans in general, no matter where you live in the world, and related to myeloma. And so my advice would be go look at those, and definitely, just like you do, Lisa, and Jim and I both do, you have to be an advocate for yourself. You have to be your own best advocate when it comes to your cancer, no matter what your ethnicity or nationality is. And so the best thing you can do is speak out. But in particular, for that subset of myeloma patients, go look at those websites for more information.
Great, thanks, Sherry. Jim, there were a couple of questions that came up for you, and I will mention that your book is called The Man in the Arena. It can be ordered via Amazon. There's a link that I think was put in the chat or in the Q&A. But one of the questions, I think it's relevant because this does come up with some patients who've been treated for myeloma. The question is, what types of leukemia did you get? What was your second cancer that you developed? Somebody's asking if that was MDS.
Well, it started out as MDS, and the progression from MDS to the type of leukemia, it was AML leukemia. The progression from MDS to AML is detailed in the book. I would like to make sure you understand the profits from the book go to cancer charities. So the book was only written to try to give some people some hope out there.
Yeah. All right. Thank you, Jim. And I know there is some concern when people go on these therapies, something they need to talk to their doctor or their specialist about. What are the short-term side effects of every medication? And also ask, what are the potential long-term side effects? That's something that I've always been cognizant of and a little bit worried about at times. So something to not only ask the question about, but to keep an eye on too. So I just want to comment too, I've had a couple of people ask about chemo brain, the brain fog, the kind of fatigue, and one person mentioned clumsy feeling. So when it comes to chemo brain, I have found, we can mention that to our providers and the nurses, and that it's just something you're going to have. So, but that's hard to hear that. What I have found is that when I talk to other patients, when I go to the support groups, when I have met patients like we're doing here, and hear their stories, it almost makes me feel like I'm not alone. So when people are going through that, and there's one person here who I saw comment online, other myeloma patients seem to know exactly what I'm describing. That is one of the benefits of connecting through these webinars and through some of the support groups, is we kind of understand each other. It helps us understand or support each other because we understand each other.
One of my doctors gave me great advice in that regard. He said to me, Jim, you got to remember you're older now than you used to be.
Doggone it, that happens no matter what.
So guys, it's not all cancer.
That's true. That is true. So I'm going to put up my email address here. This is super unprofessional, and my engineer husband would be dismayed because I'm not very tech savvy. This is my email address, cureformm@gmail.com. I put that up. There's probably backwards too. Sorry about that. I put that up there just if you do have questions, you can email me. I may not have the answer, and oftentimes don't have the answer. I will usually call Sherry if I don't, because she can find some resources. So please feel free to email me directly. If we have your email address, like I said, we will get back to you on your email if you've had questions. I think we're going to have to close up this Q&A. I have so many more questions I'd like to answer. You know, it sounds like a lot of people have the cramps, different side effects. How do we deal with that? Is that common? We're going to close this up for now. We're hoping to have another one of these programs in about 2 months. Jim and Sherry, thank you so much for sharing your stories and your experience. For all of you at home, thank you for joining us. I love hearing stories of other people. That's why I do this. I love to hear their experience. I hope that even if there's just, like I said before, one little piece of information that somebody can take from this and ask their doctor about, which we want you to do, please do so. We all have a hope for a cure. I wanted to talk about an algorithm for a cure. Sure, I said that. I don't know if there actually is. Everybody is different. There's nothing definitive yet. I've heard doctors say, well, if you're 10 years out without treatment, one doctor said, well, I would call that a cure. So it just depends on who you're talking to. I have high hopes for a cure, and I hope it's soon for all of us patients dealing with this. So thank you again. Thank you for joining us from home. We really appreciate you taking time out of your day. Have a great afternoon.